after the legislative session last year, and unless something goes very, very wrong in the legislative session this year, starting in a few months, he will be the primary day-to-day regulator for not only agents but also navigators in the state of Louisiana. So that's why Barry has a very important role in this conversation today. And they probably all notice I've shortened the length of their bios so that we can have more time to talk. Hopefully they don't mind. I'll just say very briefly, in terms of the role of navigators and producers, one of the things that I hope we touch on today is that navigators and health agents have essentially the same role with just a few differences. They engage in public education, they distribute information about enrollment, about tax credits, about subsidies, they facilitate enrollment, and they provide referrals to state regulators and federal regulators when necessary. And that's essentially under federal regulations, that's the description of the role of navigators, and agents largely do the same work. I think just traditionally, agents have longer-term relationships with their clients and do more. Once they have a client and enroll a client in coverage, they tend to continue to have that relationship throughout the policy year, helping their clients with problems that arise with insurance companies and with general questions they have about healthcare services. And so there's some overlapping and some differences in the roles of navigators and producers. And that's one thing, hopefully, that we touch on today. Another thing I'm hoping to talk about, and if we don't, then I'll try to pull us to it, is the challenges that navigators and producers face. There's some common challenges that everyone faces, and that's the day-to-day changes that we see in federal regulations, in the IT problems and solutions to those problems with exchanges. There's a general lack of public awareness about some of the specific requirements for individuals and businesses, and it's the role of navigators and producers to try to educate consumers on what their responsibilities and options are under the law. The cost of health care continue to rise, which creates problems not only for consumers but with navigators and producers who try to find the best coverage for someone in that situation. And then there's the complexities of the market. The market reforms are, I think the Affordable Care Act ended up being around 900 pages, and we're at somewhere around 22,000 pages of regulations, give or take. And so the complexities of the market require people who can help consumers understand what their responsibilities and requirements are without expecting them to read all of that. And then there will, of course, be continuing technical problems with enrollment through exchanges. There are some specific challenges for navigators that I'm thinking Brian might address, and that's limited resources. How do you reach out to people in a state with 4 million, with a population of 4 million, and have a little over, I think, $1 million in total grant funding to do that? And then the long-term, I won't say viability of the program, but the long-term funding of the program is in question. And then producers have their own challenges. In the latest medical loss ratio reporting forms that were filed for the latest reporting period, health insurance companies across the nation had cut producer commissions by about $300 million, which is on top of cuts from the year before, and there's every indication that that reduction is going to continue. And yet at the same time, we've seen the number of registered agents increase, I think, year over year. We have about 7,000 more health agents than about a year ago, so there's more people in the market, and but reduced commissions. And then finally, something that will present a challenge for navigators and producers that Josh Goldberg had talked about earlier. In the final market rule, it's eventually going to be the employee choice option in the shop exchange, where your employer says, my employees can pick any silver medal or gold medal plan that they want on the exchange, and I pay a certain amount. And how that functionally will work is a big question. But in terms of navigators, but I should say especially agents who are accustomed to helping an employer pick a single plan, it's going to be more difficult. It's almost as if you go from maybe have to go from a wholesale situation to a retail situation. How do you, as an agent, how do you handle it if instead of convincing one person at a company about what plan to pick, you've got dozens, hundreds of employees who will then be making their own decisions. So there's challenges ahead, and hopefully some of that can be addressed today.
Good afternoon. Thank you very much. Apologize for the technical difficulties. On August 31st, Louisiana Area Health Education Centers. Linda asked the question earlier, who knew what an FQHC is? I'm going to ask if anybody, raise your hand if you know what an AHEC is. Area Health Education Centers. Congress found area health education centers in the early 70s in order to help meet healthcare disparities. There are 4 area health education centers in the state of Louisiana. North AHEC covers the Shreveport, Monroe, Natchitoches area. Central AHEC covers the Baton Rouge, Alexandria area. Southwest Louisiana AHEC covers the Lake Charles, Lafayette area, and Southeast AHEC covers the New Orleans, Houma, Thibodaux, Bayou Land. So together, the 4 AHECs, the Louisiana Area Health Education Centers, cover all 64 parishes. We are basically a public health foundation. Our goal is to identify health disparities in the state, to raise the money that we need to combat those, and to provide community outreach and either individual community level or group level interventions to try and change those. We have been in practice in doing this for the last 25 years. We tend to focus on things like STD, HIV prevention. We focus on immunizations, obesity prevention, smoking cessation. Those are several of the different public health factors that we have. And we looked at navigating and understanding the Affordable Health Care Act and healthcare and insurance literacy as a health disparity in our state. And so when we joined our consortium of the 4 AHECs, and we applied to serve as the navigator entity in Louisiana, and on August 15th, 2013, we were awarded $1.1 million by HHS to set up a navigator program. I'm glad it's not me. Okay, so there's the map. These are the federally, these are the 4 different areas of Louisiana that they cover. Next. Out of that $1.1 million, this is kind of a distribution and a flow chart of our program. What we were able to do was to allocate those resources based on where the number of uninsured and underinsured in the state of Louisiana were. So as you can see, the most uninsured are in the southeast part of the state. That is why we have the most navigators in that area. The southwest part of the state had the most insured, therefore they have the least amount of navigators. There's just a picture of some of our navigators. We have 19 navigators within our program, counting myself. Our role is to serve as an in-person assister for those needing help understanding and navigating through the insurance marketplace. Again, our role, we are not insurance agents or insurance brokers. We are public health people. Our job is to explain to people what the Affordable Health Care Act is. Basically, we explain for a typical consumer, ACA does 2 things. It makes sure that there are those 10 essential benefits in all plans, and it connects people to providers located within their community. And so that's what our job is to kind of help explain that health literacy. For most of the people that we worked with throughout this, the open enrollment period, these were people who had never had access to insurance. So health literacy and insurance literacy was a big part of what we do, having to explain the difference between co-insurance, co-payments, deductibles, and how those work. At the same time, explaining to the community the changes within Louisiana's charity health hospital system. And so that was a big challenge that people had to understand. Next. There are 4 entities in Louisiana that were funded as navigators. There is the Capital Area Agency on Aging District 2, which kind of did a little bit of, received a small amount of money, did some outreach to nursing home employees, hospital employees around the Baton Rouge area. There was also the Martin Luther King Health Center out of Shreveport. They did some outreach to those that receive services through their clinic, as well as others in the northwest part of the state. Southern United Neighborhoods had some very strategic work throughout the state, but we were kind of the lion's share of that program. So what is a navigator? Navigators were defined in the Affordable Health Care Act as in-person assistants. Our job was to provide community outreach and education to people in the community to help them understand and to navigate the marketplace website, and then to also help them to understand what the qualified health insurance plans were and what the differences in those are. We are not a political entity. Our role as an AHEC is not necessarily for the ACA or against the ACA. We start off our presentations by explaining, if you're not happy, contact your congressman. We're not our job is to help people to understand that health literacy. So what was the first thing we did? The very first thing we did is, besides hiring the staff and doing the contracts, was pulling together advisory boards. We had a statewide advisory board made up of everything from Louisiana Primary Care Association, Louisiana Public Health Association, Louisiana Public Health Institute, and all the different Louisiana organizations that had a stake in making sure that the constituency of people that they represented had access to this information. We also convened several regional advisory boards. So we had regional advisory boards in Shreveport, in Monroe, in Natchitoches, in Alexandria, Lake Charles, Lafayette, Houma, Thibodaux, Baton Rouge, New Orleans. And so we also had and I'm going really fast because I want to give everybody, the most that you're going to get is through the questions. So I'm going to give everybody a chance to go through. So we pulled together our advisory boards. They kind of gave us a roadmap to where we needed to go and the people that we needed to talk to. The next thing we did is we did community mapping. We made sure that we understood where those pockets of people were that were uninsured and underinsured in Louisiana, so we would know best how to reach out to reach those people and to use the limited resources we said. As Corey said, we have 19 people across the state as the navigators, and this is the state's largest navigator program. That's a lot. There's a lot of uninsured for those few people. So we really had to make sure that we were getting the biggest bang for the buck, and we were having the greatest impact in the short amount of time that we had. I mean, we had 1.5 month between the time that we were notified until open enrollment. So we were very proud of the fact that we moved along so far. Also, what we did is we worked to find those people within the community that had a constituency of people that needed access to the information that we had. That was really big in the community outreach perspective. We were not setting up community outreach and inviting people to come in. We were working with those gatekeepers in community that already had people. Say maybe pastors of church, leaders of organizations, community leaders, elected officials, those people that could reach out into their constituency and say, if you need access to the information, here are the resources available to you. So between October 1st and April 18th, we did a total of 1,358 outreach events across the state, and we met with, in that short amount of time, 33,843 people. We also, I think for us, what was so important was the partnerships that we created with doing this. We had a very special partnership with Louisiana Primary Care Association and the FQHCs across the state, where we would work in cohorts together. We would do the community outreach and education, and they would do the enrollment process. And so that was what we found really worked for us. We would start off by doing community presentations. We did them at libraries, we did them at civic centers, we did them any place that would allow us to come in and meet with people. We start off by a PowerPoint presentation. Basically, we called it ACA 101, explaining what the Affordable Health Care Act is, what it meant to people, how it worked, how subsidies worked, what those federal poverty limits, many people did not understand what does 100 to 400% of the poverty level mean. So we explained that to them. We explained to them everything that they needed to know. And what we were hoping, and what we think happened, is that from those community educations, people were able to go on and they were able to go online, minus the difficulties they had getting online, but were able to go on and do that themselves. Or they were able to seek out resources within their community. If not, we were right there. All of our navigators were mobile. We did not set up in the metropolitan areas. We made sure that we were in all rural communities so that people would have access to us. And so that was our education, was through the PowerPoint and through handouts and through information. Next. We also use social media. Facebook, Twitter, YouTube videos. Those were all of our friends. We used those to be able to get out into the community and tell the community where we were. The one thing that we did different that I have not seen any of the other navigators do is we created a website. And our website is, we'll go back one, our website is lahealthcarenav.com. And what this is a local Louisiana face to the healthcare.gov website. So everything that you needed from healthcare.gov, you would be able to navigate through this website, but it was very localized. It started off, we in Louisiana are an unusual group. We can get really confused about information from Utah and New Mexico. So we tried to weed all that out there. We wanted to make sure that when you opened up that page, you saw families fishing, you saw Mardi Gras festivals and crawfish. And what you were able to do is there's an we'll go to the next page, and it looked better than this. This is all squunched up so that you can see this on the screen. But there's an interactive map of Louisiana. You can click on the parish that you're in, and it'll list all of the different educational opportunities that you have to go out there and to learn what you need, as well as resources. There was we included the Kaiser Family Foundation calculator on there so that families were able to see what their subsidies, and we tried to give them every bit of information that they need, very specific to Louisiana. Some of our outcomes, and I'm not going to, 97,208 Louisianans enrolled in qualified health plans. As of April 12th, that is 158% of what CMS projected for New Orleans. We were about 92% of what CMS projected for Louisiana. The rest of the numbers we're going to go ahead and kind of skip through because they were already given early today. We'll go to the next one. So what's next for us? So our job was 90 to nothing, helping people with enrollment through the April 15th. Now our focus is that we are helping the people with those special circumstances that allow them to enter the marketplace outside of open enrollment. We're working with them on that. We are also working with consumers to help them prepare for the November 15th open enrollment. But also we're beginning to focus on SHOP. We're beginning to identify who the small business is around Louisiana. Those mom and pop organizations that now need to be able to provide insurance for their employees and don't know where to go. We're working with them, we're reaching out to them, we're explaining to them how the marketplace works, we're helping them to choose those plans, and then we are connecting them to an agent or a broker within their community to actually help with that enrollment process. We are taking this up, we're just educating. We know that now that people have their insurance and they're beginning to use it and they're talking to people within their network, we're getting more and more of a demand for people that are interested in participating. We also know that as those penalties start to go up, that is more of an encouragement in 2015 than it was in 2014 for people to enter the marketplace. So as we see the demand pick up, we are there for them. But our big thing is to identify and identify. This is my information across at the top. My email address is the word interventions at swlahec.com, or I can be reached 337-478-4822. Also, I'll be more than glad to share this slide with anybody. It has all 64 parishes. Within our Navigator program, we have 4 regional coordinators, and then under those, we have the navigators. I'll be more than glad to connect you with a navigator or a coordinator in your area. So thank you very much.
My name is Hetty Hebert. I'm the president of Louisiana Association of Health Underwriters. I'm from the Bossier City area. And thank you for the opportunity to come today to present the agent perspective on affordable health care. March 23rd, 2010 was the birthday of affordable health care. So 4 years ago, they recently had a birthday. And with it came many changes to the world of employee benefits, whole new world of health care reform. The kinds of coverage available have changed, as have the requirements and options for employers and employees. With it came confusion, I think y'all know that, challenges, but opportunities also exist, many opportunities. Your agent is ready to take care of you. Why use a producer? Service after the sale and knowledge of the healthcare delivery system is probably key. We've worked with companies and individuals for years, and we have to take education. Some of us are certified, many of us are certified. We all have to have a state health insurance license. And if we sold on the exchange, you had to take the federal marketplace training, very extensive training, as y'all know. And we all have E&O insurance, and that's to merely protect our consumer. Many have become specialists in the Affordable Care Act, certified health care reform specialists. And I will say this, no matter how many designations you hold, how much education you have, if you don't constantly keep updated on the changes that are out there, it doesn't do any good, because you can learn something 3-4 years ago and it's going to change daily. If you don't believe that, ask our human resource specialists when you go to companies and you work with them. We take CE classes in ethics training for the protection of our consumers, and this is required. I've talked to many agents around the state that have taken a hit financially, and y'all know some of the cuts in commissions and things like that. And some have left the market, some have gone on to do different jobs. But I will say that the agents that stayed in the business are more committed than ever to take care of their business. One thing, Brian asked us if we had heard of AHEC before. And I have to tell y'all, I just met Brian today, but Brian, I'm the healthcare consultant that does North Louisiana AHEC. So there are ways that we can all work together that we may not know each other, but in the course of time, we're willing to help in any way we can. Other value-added services, producers possess highly technical skills that are needed in order to advise clients on the SHOP plans and the small business healthcare tax credits. And Brian spoke on that, the fact, agents have worked with these companies for years. Who knows better what the needs are for companies if they do, maybe they have 2 or 3 or 4 people. And y'all know the cost of healthcare now is higher than it ever was. And so we have several companies that we've dealt with that just they're doing away with their benefits. And so they find that with the subsidies that are available for some of their employees do better to leave that small group and go into the exchange. So that's what we monitor on a regular basis. We don't try to keep employers in their group plan if it just doesn't make sense for them to do that. Many of our producers are in the employer benefit world, which is much different than the individual market. Many producers are involved in the implementation of wellness programs, as are many of our carriers. They've all started wellness programs that's in the Affordable Care Act. And, to change lifestyles and to be better consumers of health care, that's what is going to make the cost go down eventually also. Producers can guide small employers in their decisions whether to move to the exchange, and they have knowledge of the premium tax credits as well. What does this mean to the consumer? There is absolutely no difference in the cost of the premium whether they use a producer or a navigator. Producers and navigators should have the same goal, and that goal is to help as many Americans as possible to receive health insurance. I don't know how many times before the health care reform kicked in that I could not help someone that had a pre-existing condition. And I met people that, you want to help so bad. Well, now there's a lot of opportunities for navigators and for producers. And there's limited state funds and federal funds to get the word out so that people do know. I know that after April 1st, the individual mandate was there, and we all knew that. We heard it on TV. We've known it for years that was happening. But there were so many people that didn't get it that started calling later to find out if they could get health insurance, which unless they've had a special event or something, they can't get it now to open enrollment. So there's a lot of people learning really fast what they need to do this next the season when it comes for open enrollment again. The Louisiana Association of Health Underwriters, our membership consists of health insurance agents, brokers, general agents, consultants, employee benefit specialists, and representatives from our carrier partners. The majority of our members are also owners of their own independent small businesses, so they get it when they see what's happening to cost. What LAHU supports: insurance agents and navigators should be licensed in order to educate consumers and should also have background checks, and I know that we all agree with that. We support House Bill 764, which has been heavily endorsed by everyone, and we feel like will be passed, but it provides for the licensing and regulation of health insurance navigators and registration of non-navigator personnel by the Commissioner of Insurance. We believe in preserving the traditional responsibilities of state insurance departments. State regulation has proven that it effectively protects consumers and ensures that promises made by insurers and licensed professionals are kept. Affordability is ultimately the key to the success of healthcare reform. Sensible solutions in the healthcare marketplace help control healthcare costs. In summary, agents and navigators should partner wherever possible to assist more Americans in obtaining health insurance. We've all heard today there's a huge market out there. Agents should continue to participate in lobbying, legislative efforts to help make positive improvements to PPACA. There's still loopholes in the Affordable Care Act that as we find different things that don't work, as we talk to employer groups, rather than just talk about repealing it, we feel like let's go try to fix it. Let's find common sense solutions that can fix some of the problems that we have. We go to Washington, we lobby in Baton Rouge, we're here a lot at the legislature. So our goal is to let our legislators know what we hear from employers, and not only employers, but from individuals. We have several individuals that have brought key information to us that we take to our legislators. Navigators have a crucial role to play in the marketplace, but agents also work with organizations to help Americans access the health care they need, as well as educate the policymakers about the vital role that they're helping to make health care affordable. LAHU is also proud of our relationship with our carrier partners, with the Louisiana Association of Health Plans, and the Louisiana Department of Insurance. PPACA is now the law of the land, and we should all work together to enroll as many Americans as we can, understand the timelines for implementation of the provisions, and work together to change legislation that adversely affects individuals and employers. There's still many people unable to access benefits because they fall into that gap without Medicaid expansion. One thing that I've done since in my own personal work with the Affordable Care Act and all the classes I've taken in it, the one thing that I've found, there's 3 websites that are crucial to staying updated with, and you can go into the internet, you can sign up to get email alerts and all that, and that's the www.hhs.gov, IRS.gov, and the Department of Labor.gov. The Department of Labor has a lot of information and frequently asked questions. So thank you again for allowing me to come today. I appreciate the opportunity to come and share our perspective. Thank you so much.